Hello everyone, how are you guys? In our today's lecture we will discuss about anticholinergic drugs, which are also known as parasympatholytic drugs. In our last lecture we discussed about cholinergic drugs, which are also known as parasympathomimetic drugs. So parasympatholytic drugs, we will discuss about them by organs, by one organ. We will start with stomach. In stomach, there are mainly present M1 receptors in the gastric ganglia. Stomach also contains M3 receptors. So, if we block the M1 receptors, so there will be less secretion of acid, and we can use this for peptic ulcers. So, the drugs which are M1 blockers are pyrazipine and tilazepine, and these can be used for peptic ulcers as they decreases the secretions. Now, as a drug which we discussed in last year, atropine, we cannot use atropine in M receptor blocking in stomach because it decreases the GI motility. That's why it is contraindicated here. Next is about the heart. As we know, heart contains M2 receptors, and if we block M2 receptors, then there will be bradycardia-like conditions. So, if we block M2 receptors, then we will get the conditions like bradycardia and AV block. And for these purpose, for blocking M2 receptors, we can use the drug atropine. Atropine will cause bradycardia initially and mainly, but it also causes tachycardia due to the blockade of M receptors on vagal nerve. But mainly it will cause bradycardia. Next is about bronchus. Bronchus is a part of lungs. Mainly, bronchus contains M3 receptors. As M3 receptors causes bronchoconstriction, and if we block them, then there will be bronchodilation. And bronchodilation is a kind of useful condition for the patients of asthma and COPD. COPD is chronic obstructive pulmonary disease. For this purpose, we can use the drugs like ipratropium and tiotropium. Ipratropium is fast acting, whereas tiotropium is long acting. What is the difference between these? The fast acting drugs are metabolized quickly and they work for a short duration, and long acting drugs are metabolized slowly. That's why they act for a longer duration. The fourth one is about the bladder, urinary bladder. It mainly consists of M3 receptors. M3 receptor mainly causes bladder constriction, and if we block these receptors, then there will be bladder relaxing, which will cause the urine retention inside the bladder, and we can use the blocking of bladder, M3 blocking, in overactive bladder, which is the instability of detrusor muscle. Detrusor muscle is the muscle of bladder, and we can also use this in urinary incontinence, which is involuntary urine. So drugs which we can use is for this are mnemonic soft bladder, in which S for sulfenacin, O for oxybutynine, F for flavexate, T for tolterodine and trospium, and B for bariphenacin. Now the fifth one is about the glands, or endocrine glands. They also have M3 receptors. So M3 receptors increases the secretions of these glands, and if we block them, they will decrease the secretions. M3 blocking leads to the conditions like dryness of eyes and dryness of mouth. Mouth dryness is also called xerostomia, the scientific term for this. And the drug which we use for M3 blocking in glands is glycopyrrolate. It is also a pre-anesthetic anticholinergic drug. About this we will discuss later. The sixth one is about the eyes. In our eyes, M3 receptors are present, and M3 receptor causes miosis in eyes. If we block M3 receptors, it will cause mydriasis in eyes. And mydriasis is a kind of contraindicated condition in angle closure glaucoma, a kind of pathology of eye. So now there will be two conditions by M3 blocking, is mydriasis and cycloplegia. Mydriasis is beneficial in fundoscopy. Fundoscopy is a kind of retinal examination and it is contraindicated in ACG. And second condition, cycloplegia, it is the blurred vision of eyes. It is beneficial in refraction testing. Refraction testing is the giving lens to the eyes to the patient who of the blurred visions. These are contraindicated in cycloplegia. So now about the drugs which we can use in cycloplegia. For the drugs to be used in cycloplegia, as we know, there is a hormone in body, adrenocorticotropic hormone, also known as ACTH. We can use ACTH as mnemonic for cycloplegic drugs. In this, A stands for atropine. Atropine is drug of choice and preferred in childs, safe in childs, and it is long acting. C stands for cyclopentanol. T for tropicamide. Tropicamide is a short and fast acting and it is safe in adults. And H stands for hematropine. These are the cycloplegic drugs. So now we have a drug of choice for the pathology we discussed earlier, ankylosing glaucoma. The drug of choice is pilocarpine. The seventh one is about the central nervous system. In central nervous system, we will see the action of anticholinergics. There are mainly two conditions we must see in this. These are motion sickness and mountain sickness. Firstly, motion sickness. What is motion sickness? When a person is moving to any place by a bus or car, the vestibular system activated and it stimulates the CTZ, chemoreceptor trigger zone, which leads to a vomiting of the person. For stopping this, we give M receptor blockers, that is hyoscine or scopolamine, which will restrict the stimulation to the vestibular system and will not lead to the vomiting of the person. Next is about mountain sickness. It is the hypoxic condition at higher altitudes and lack of oxygen. For mountain sickness, the drug of choice is acetazolamide. At last, we will discuss about a kind of pathology known as Parkinsonism. In this disease, there is mainly the imbalance of acetylcholine and dopamine receptors molecules. The imbalance occurs hypothetically assuming that there are 100 molecules of acetylcholine and 100 molecules of dopamine in balanced condition. In Parkinsonism, the dopamine molecules reduce to hypothetically assumption like 50 and acetylcholine molecules are 100. So now we have two ways to treat this condition. If we can increase the amount of dopamine molecules or we can decrease the amount of acetylcholine molecule for balancing. For increasing dopamine, we can use drugs like levodopa. For decreasing acetylcholine, we can use drugs like benzhexol, benztropine and bipyridine like drugs. 3 Bs for decreasing acetylcholine. Now it is a bonus from anticholinergics. Anticholinergics, pre-anesthetic drugs, these are the drugs which are used prior to the administration of anesthesia, local or general anesthesias. Now anticholinergics also have some properties of pre-anesthetics. Some drugs like atropine, acipромazine, scopolamine, diazepam and glycopyrrolate. These drugs possesses pre-anesthetic properties. Scopolamine, as we discussed it in CNS, M receptor blocking, it is used for motion sickness, and glycopyrrolate, it is used for endocrine glands. So that's all. Thanks for watching the lecture and don't forget to subscribe our channel READT MED and don't forget to press the bell icon for upcoming lectures.